Hello everyone. So in this video we are going to discuss about the diuretics which act on the proximal convoluted tubule cells. So this is the second part of the diuretics. So in this we know the drugs which act on the proximal tubules, and in the proximal tubules we have to know that in the proximal tubule there is one inhibitor, that is carbonic anhydrase inhibitor, that is carbonic anhydrase inhibitor. So we have to know that what is the function of this carbonic anhydrase inhibitor in the proximal convoluted tubule cells. So suppose this is our PCT cells. So these are the PCT cells. So in the nephrons of the kidney, the sodium and bicarbonates were there because they are reabsorbed from the glomerulus. So this sodium is get reabsorbed by the proximal convoluted tubules with a antipode, with one antipode. The antipode is means in exchange with sodium there is something, that is the hydrogen in exchange. So sodium enters into the PCT cells and hydrogen comes out from the PCT cells. So this is an antipode. Now this hydrogen will react with this bicarbonate and it forms the H2CO3. It forms H2CO3. So here the enzyme, this carbonic anhydrase inhibitor will act. This carbonic anhydrase will convert H2CO3 into water and CO2, H2O plus CO2. So this enzyme is inhibited by carbonic anhydrase inhibitor. So this reaction will become stops. So now again this water is going to enter. So this CO2 is going to enter from the PCT cells and it react with H2O plus CO2 and it forms the H2CO3, and it again forms the H2CO3 with the presence of the same enzyme, that is carbonic anhydrase. So this carbonic anhydrase is going to do two functions. First, it breaks down the H2CO3, and in the second part it again forms the H2CO3 in the PCT cells. After this, the H2CO3 is again going to break down and it is break down into the H plus and HCO3 minus, and again this H plus is going to come out from the antipode. That one is the sodium hydrogen antipode, that is sodium hydrogen antipode. So this hydrogen again come back into the tubules. Now here there is one antipode. So here is one antipode, that this bicarbonate is going out with a co-transport. So here the co-transport is with sodium. So sodium and this bicarbonate co-transport is there. Sodium bicarbonate co-transport is there. So this is the normal function of the carbonic anhydrase enzyme. Now suppose if this carbonic anhydrase is get inhibited. So if it get inhibited, it means that this bicarbonate and sodium is not going to absorb from the PCT cells. So now if the means that there is loss of sodium and bicarbonate, in the urine. So this is going to lose, and that's why it is diuretics. In diuretics there is loss of two things. So here is loss of sodium and bicarbonate in urine. When the bicarbonate is going to lose in the urine, it means that in the blood there is more plus ions will be there. It means the blood will become more acidic. So blood is become acidic, that's why it is metabolic acidosis condition. While in urine there is lots of alkaline is there, so the urine become alkalosis. So urine become alkalosis, while the blood become the acidosis, because lots of H plus ions will be there in the blood. Now this whole process is a self-limiting actions, means the kidney has self-limiting actions. So here kidney has self-limiting actions. So kidney has self-limiting actions. Now if the kidney has self-limiting actions, it means that the kidney can maintain this whole process. So now more about the carbonic anhydrase. So it acts on the proximal tubule. So carbonic anhydrase inhibitors. So carbonic anhydrase inhibitors, where they act on the PCT, and it inhibits the carbonic anhydrase. So it inhibits carbonic anhydrase, and it also cause the loss of sodium and bicarbonate, in urine. And after it decrease, there is loss of sodium and water, so it is a diuresis, and urine becomes alkalosis while the blood become acidosis. So urine alkalosis and metabolic acidosis condition it is, and it has the self-limiting actions. And it, so for this we have to give there are three drugs like acetazolamide. The suffix is zolamide. Another one is the brinzolamide, and the third one is the dorzolamide. Zolamide. So here the suffix common is zolamide, and we can use all these drugs as a eye drops. So we can use all these drugs as a eye drops. And acetazolamide is can be given orally or in the injectable form. It can be given orally or injectable form. Now, what were the indications where we use the carbonic anhydrase inhibitors? So, indications where we use carbonic anhydrase inhibitors were the first one. It can be used for this. We have one mnemonic, that is the GAME. We can use carbonic anhydrase inhibitor in these 4 conditions. So, first G stands for the glaucoma. It can be used in the glaucoma, and the glaucoma is angle closure glaucoma. Angle closure glaucoma. Next, A stands for it makes the urine alkalization. So for the alkalization of urine, if the urine is our acidic, so we have to make the urine alkaline. So for that also we can use the carbonic anhydrase inhibitor. So for alkalization of urine. And M stands for the mountain sickness. For the mountain sickness also we can use the as carbonic anhydrase inhibitor. And please remember that the drug of choice for for mountain sickness is carbonic anhydrase inhibitors. Please remember this point. And the next one is E stands for epilepsy. E stands for the epilepsy. Now these all were the indications. These 4 were the indications, and in which mountain sickness, the drug of choice for mountain sickness is the carbonic anhydrase inhibitors. Now we have to study about the adverse effect of the carbonic anhydrase inhibitor. So for the adverse effects, we have to know that it is making our blood acidic. So metabolic acidosis, this is the side effect of this drug. Second one, it causes the hypokalemia. And it also causes the paresthesia condition, and it also increases the renal stone formation, because the urine becomes our urine becomes acidic, so which precipitate the stones. So renal stones, which makes the stones. So renal stones, this is also an adverse effect of these drugs. Now what were the contraindications where we never use these carbonic anhydrase inhibitors? So the contraindications were in the liver disease. In the liver diseases we should not use the carbonic anhydrase inhibitors. And what were the drugs suffix for carbonic anhydrase inhibitor? The suffix is zolamide. So acetazolamide, brinzolamide and dorzolamide. So that's all for the carbonic anhydrase inhibitor drugs. I hope this video is helpful for you. Thank you.